Hey friends, welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I'm Angela Yarborough and this is Dr. Jerry Yarborough. And what are we doing here? Well, we are talking about different disease processes, and we are just talking about different ailments, different things that keep you from loving your life. That is one of our mottos, is love your life. And we just wanted to give back to the community and just give you some things that you can do for some things that might be preventing you from loving your life. So why don't you tell us exactly what we're going to be doing?
All right. First, like I said, I'm Dr. Jerry Yarborough, physical therapist, and my sweet wife, Angela. By trade, she's actually a nurse. So, together, I opened the Jonesboro Clinic about 20 years ago. I actually have about 27 years experience as a therapist. And then 7 years ago, we opened up here in Ruston. And just about 3 weeks ago, we opened up in El Dorado, Arkansas now. So what we're doing, like she said, is we're talking about different diseases or impairments that are affecting your quality of life. And at Physical Therapy and Balance Centers, our desire is to help you love your life. So we're going to discuss those impairments. We're going to discuss how physical and occupational therapy can help you rehab from those impairments. And then we're going to always give you a takeaway of what you can start doing immediately to start making a change in your life and improving your quality of life. So again, come and see us every Thursday here on Louisiana Living. You can look us up on myarclemis.com or our personal Facebook page, physicalruston.com. Or you can even go to our Facebook page or even our YouTube channel. We have lots of videos and lots of education out there to help educate the community. Now, we want you to come back in the next two segments in which we'll start talking about certain ailments or impairments. And then, like I said, what physical and occupational therapy can help you overcome those impairments. And then again, we're always going to leave off with what you can do immediately to start helping improve your quality of life. So come back and see us and we'll get started. Thank you. Welcome to Therapy Thursdays here on Louisiana Living. I'm Dr. Jerry Yarborough, physical therapist and owner of Physical Therapy and Balance Centers. Now today we're going to be talking more about balance. As you remember, I personally had a balance issue about 13 years ago. I had viral meningitis and encephalitis, so I had no sitting or standing balance and had to go through my own rehab. So balance is a big thing that we do here at the Physical Therapy and Balance Center. So I want to go into it a little bit more today. So we talked about different components that affect our balance, okay? So for sighted people, we use our vision a whole lot to help us maintain our balance. Now, of course, strength and flexibility play really important roles in being able to maintain our balance. But the other two major systems are the vestibular system, which is in between my fingers here. It's in our inner ears. There's canals and other organs, and it will tell our brain whether we're looking right, left, up, down, sitting up, or laying down. And then the third main system is the somatosensory system. Somato means body, sensory is what it is, sensory. So the sensory system of our body, which is receptors in our skin and our muscles and our joints that tell our brain kind of where we are in space, whether we're standing or seated, whether we're on a nice firm surface or an uneven surface, whether we're walking, running, going uphill, downhill, all that kind of information. And so we're going to focus on that today. And I want to tell you different impairments that affect our somatosensory system. So first, any kind of neurological impairment with a stroke, having Parkinson's disease, multiple sclerosis, muscular dystrophy, Parkinson's, all of those neurological conditions can definitely affect our somatosensory system. But other things that you may not think of that will affect your somatosensory system could be even diabetes, as diabetes affects every organ in our body. And then also, like after having a surgery, if you've had a knee replacement or any kind of knee surgery, that interruption in the normal tissue integrity will impair your somatosensory system. Pain itself and swelling definitely impair our somatosensory system. So come back in the next segment and we're going to talk about different ways, different activities that you can start doing today to help improve your somatosensory system, which will overall help improve your balance. Welcome back to our segment here on Therapy Thursdays. I am Dr. Jerry Yarborough, physical therapist and owner of Physical Therapy and Balance Centers. Now, here we do specialize in balance and vestibular rehab. And one reason we do that is because 1/3 of the population over 65 will have a fall each and every year. So it's a national epidemic, it's very serious, and we are the regional experts in helping people overcome those impairments. To demonstrate the activities that you can start doing today to help improve your somatosensory system, we have our demonstrator here. This is Josh Sullivan, and he is a student here from South Arkansas Community College. He'll be graduating next month, right?
In May.
Awesome. So he's going to demonstrate as I instruct what you can start doing at home, okay? So remember, we're working on just the somatosensory system or trying to kind of pin that down. So a good exercise is to just stand on one leg. Work on standing on one leg like Josh is doing here. And then as you can do this for at least 10 seconds, and then I want you to close your eyes. Now you should always do this in front of a stable surface, kitchen counter or the back of the couch or something in case you lose your balance, okay? Once you can stand with your eyes closed for 10 seconds, then you can find a soft surface, like we have foam pads here. You could use a pillow or some surface that's kind of soft, okay? So now you're gonna do the single leg stance on foam. That challenges your somatosensory system even more. And then again, to make it harder, you're gonna try to do it with your eyes closed. As you can see, even this young man has some difficulty doing these. These really challenge your somatosensory system, which will overall help improve your balance and help decrease your risk of having a fall. So I want you guys to come back next week as we talk about some more impairments and how physical and occupational therapy can help you. So have a good week and thank you.